Hi everyone, and welcome to today's webinar. My name is Margot and I will be your moderator. We're going to get started in 2 minutes. Thanks. All right, thank you for joining today's webinar, RS85 Prestige Launch, hosted by Samsung. If you guys have any questions throughout the webinar, please feel free to submit them through GoToWebinar, and we will review them at the end of today's webinar. If we do not get to your question, expect a follow-up via email in the next few days. Additionally, don't rush to take notes. You will receive a webinar recording via email later this week. With that, I'm going to turn things over to Dan to begin the presentation. Dan?
Thank you, Margot, for that introduction. Welcome everyone to today's webinar, where we introduce Samsung's newest platform, the RS85 Prestige. Thank you for being here, and we really do appreciate you joining us. As Margot mentioned, I'm Dan Monahan, Senior Ultrasound Director at Samsung Neurologica. We're excited to share important information about the revolutionary new features on the RS85 Prestige. Today's webinar will have 3 speakers highlighting the system's advanced and innovative capabilities. The first speaker, Wanchul Bang. Wanchul is the Vice President of Imaging for Samsung Healthcare. He will be discussing why Samsung's uniquely qualified to bring innovation to healthcare and specifically diagnostic imaging. A product presentation will then follow. After that, we're honored to have Dr. Ron Hidalgo join us. Dr. Hidalgo is a noted radiologist from Springfield, Illinois. He has more than 11 years of diverse medical experience with an emphasis in diagnostic radiology. He graduated with honors from the LSU School of Medicine in Shreveport, Louisiana. At the end, there'll be some time for brief closing remarks. If for any reason you have to drop off of the event, it will be recorded so you can watch it at your leisure. Again, thank you for joining us today, and I will now turn it over to Vice President Bang.
Hi everyone, I'm Wanchul Bang, team leader of Samsung Healthcare's product strategy team. Thank you all for joining us for the RS85 Prestige online product launch. Samsung Healthcare's R&D team determined 3 factors that are essential in a premium level of ultrasound system: image quality, advanced diagnostic tools to increase your diagnostic confidence, and workflow efficiency to reduce the workload and healthcare professionals. Based on these 3 pillars, we adopted Samsung's unique imaging technology, AI, and user experience for the RS85 Prestige, our premium product for radiology. We appreciate all the healthcare professionals who continue to fight COVID-19. While it is still difficult for face-to-face contact, we want you to know that Samsung is working hard to provide the best technology to meet your ultrasound needs. We hope that you enjoy our online launch of the RS85 Prestige. Thank you again for attending the event. I'm now going to pass it over to Sarah, who will present RS85 Prestige.
Thank you, VP Bang, for the introduction and for the interesting information about Samsung and its commitment to diagnostic imaging. Meet the RS85 Prestige ultrasound system. This enhanced system represents a revolutionary change in advanced diagnostics. RS85 Prestige was designed to deliver the ultimate scanning performance. In the next several minutes, I'll walk you through the many features and benefits of the system, including a number of tools for liver analysis. As VP Bang talked about, Samsung has gathered technology DNA for more than 50 years as a leader in consumer electronics. That technology leadership is built right into the Prestige system. It's how RS85 Prestige is able to effortlessly deliver consistent, superb image clarity, impressive depth of penetration, and increased color sensitivity. Everything about Prestige was created to be easier to use for the sonographer and to enable a more efficient diagnosis for physicians. The oversized ultra-high resolution monitor enables examination with a wider view at a glance. The touch screen can be adjusted to the user's view within any scanning environment. A customizable touchscreen interface makes it easy to move frequently used functions to the first page. That makes the system easier to operate, and it also keeps the focus on the patient instead of the system. The 6-way adjustable control panel enhances the work environment to reduce repetitive motion stress. In off mode, the panel returns to the home position for easier mobility. A single pedal controls the central lock mechanism to conveniently secure the console in place. This makes for more efficient movement while scanning procedures are being performed. 4 swivel wheels allow for easy steering. A locking function keeps the system in place. Exceptional image clarity and penetration is built upon Samsung's innovative crystal architecture. Crystal architecture is built upon a combination of innovative beamforming, sophisticated image processing, and advanced S-view transducers. The result is clear, uniform, and high-resolution images like these. These clear images mean diagnostic confidence on even the most challenging of patients. Ultrasound professionals can return their attention to the individual patient without needing to excessively manipulate controls. Crystal Pure image processing delivers sophisticated 2D and increased color sensitivity. That provides for more confident assessment of blood flow within anatomy and pathology. Crystal Pure provides a number of additional features. These include Shadow HDR, which suppresses shadows and enhances clarity and grayscale images. Here's a side-by-side of a liver image without Shadow HDR and one with Shadow HDR. HQ Vision compensates for the natural signal distortion as sound propagates through tissue to display maximum pixel sharpness. Here's a side-by-side comparison of an image of the same wrist without HQ Vision and with it. MV Flow is another sophisticated feature. It uses advanced Doppler technology to provide detailed documentation of microvascular perfusion in the tissues and organs. Here's an example of a kidney image with MV Flow, and here's one of a breast image. The last feature I'll highlight is Lumaflow. Lumaflow is really helpful in that it displays a 3-dimensional-like appearance to 2D color Doppler. The result is an enhanced spatial comprehension of blood vessels. The image on the screen is of a liver using both Lumaflow and S-Flow. S-Flow is a highly sensitive directional power Doppler that's excellent for assessment of slow blood flow. RS85 Prestige has a number of built-in intelligence technologies to further assist ultrasound professionals and make for more confident assessment of anatomy and pathology. These advanced technologies include liver analysis tools. These tools are designed to make it easier to calculate hepatorenal index and to assess steatotic liver changes, tissue attenuation, and backscatter. The first technology is called EasyHRI, with HRI standing for Hepatorenal Index. This is a semi-automated process to quantify liver steatosis by comparing echogenicity of liver parenchyma to renal cortex. EasyHRI positions 2 ROI on the ultrasound image, liver and kidney, to calculate hepatorenal index. TAI, tissue attenuation imaging, provides quantitative tissue attenuation measurement to assess steatotic liver changes. TSI, tissue scatter distribution imaging, provides quantitative tissue scatter distribution measurement to assess steatotic liver changes. Shear wave imaging is another of these advanced intelligent technologies. It allows for the non-invasive assessment of the stiffness for tissue and/or lesions in various applications, such as liver, breast, MSK, and prostate. Color-coded elastogram, quantitative measurements, dual or single display option, and user-selectable ROI functions are especially useful for more confident assessment of liver or breast diseases. S-Detect is another technology for standardized reporting and classification of lesions for the breast and the thyroid. For performing liver and prostate interventional procedures, RS85 Prestige gives you a wide range of precision technologies, including fusion and needle tracking guidance. S-Fusion for the liver is a technology that enables simultaneous localization of a lesion. It uses real-time ultrasound in conjunction with other volumetric imaging modalities, such as side-by-side MRI. Samsung's auto-registration helps quickly and precisely fuse the images, increasing efficiency and reducing procedure time. S-Fusion enables precise targeting during interventional and other advanced clinical procedures. In addition to these advanced assessment tools, Prestige was built to enhance productivity and facilitate workflow. The goal being to support daily procedures by reducing keystrokes and combining multiple actions into one. Sonosync is one of these workflow solutions. Sonosync enables real-time image sharing for collaborative communication. It allows care guidance and training between doctors and sonographers, regardless of their location. It also includes voice chatting and real-time marking function for efficient communication, and the multi-view function is included to monitor multiple ultrasound images on a single screen. That's the RS85 Prestige from Samsung. It delivers exceptional imaging performance, ease of use, and superior intelligence. It's the revolutionary change in advanced diagnostics that you've been expecting. Thanks for joining me. Back to you, Margot.
We are excited to have registered diagnostic medical sonographer Jenny Terwilliger with us today. Jenny has extensive sonography experience and has been using the RS85 Prestige now for some time. Welcome, Jenny, and thank you so much for joining us to answer some questions and to talk about your experience with the Samsung products.
Yeah, absolutely. Thank you for having me. It's nice being here.
So why don't you give our audience a little background on your ultrasound experience?
Sure. I'm a registered diagnostic medical sonographer. I've been scanning for approximately 22 years. I hold credentials in abdomen and OBGYN. Most of my experience is within abdomen, but my passion lies in OBGYN.
It's pretty impressive. So how long have you been using the Samsung equipment?
Yeah, I've been using the RS85 for approximately 2 years and the new platform since it was introduced this year.
Now, I have been told that sonographers are a key part of the evaluation process of new equipment. What are some of the features that are an absolute must when making a decision?
Yeah, what you were told is right. We are part of the process. The features might vary depending on what type of exam that we're going to perform. But overall, the key features that we evaluate are ergonomics and ease of use, which includes the ability to customize image quality, especially at deeper depths.
Okay. So can you elaborate on each one of those topics and maybe show us how the Prestige meets those capabilities?
Sure. Ergonomics is not only about moving the system up and down and side to side, but also other features such as probes and limiting the amount of keystrokes needed to perform a particular exam. The Samsung transducers are lightweight. The grip is designed specifically to relieve repetitive stress. Customization is also part of ergonomics. So if I can eliminate keystrokes, that reduces the fatigue, which helps me to maintain consistency throughout the exam. For example, the easy prep on this machine, I can select a transducer and do an exam with one single keystroke. I can also customize the touch screen and create protocols. So what that means is that with the touch of a button, it walks me right through the series of images that I need to take for that particular exam.
I think what's also awesome in that regard is that, you know, it's less time consuming for the patient.
Yes, absolutely.
So those appear to be really very helpful features, but tell us some other features that set the Prestige apart from other ultrasound equipment.
Yeah, well, there are several. The Prestige has some advanced color technologies. One of those being the MV flow, which stands for microvascular flow. That helps me to quickly pick up the perfusion, especially within the kidney. Now, if I combine that with the Lumaflow, which is the 3D component, that's not only impressive, but that gives me the diagnostic confidence to report back to the radiologist. Then there's the Shadow HDR. I scan a lot of difficult patients, so acquiring images intercostal is very common, but unfortunately the ribs will get in the way. So what I do in that situation is I'll turn on the Shadow HDR. That eliminates the rib shadows and enables me the ability to see behind. That feature is a must for me, and I use that daily.
Well, I imagine if I was a sonographer, I couldn't imagine scanning without those features particularly. So what other features do you personally and particularly find helpful?
Well, what I'm most excited about is the liver solution package. It's new, so I really haven't worked with it much, but I believe it's going to be a real game changer for me. We see a lot of patients with NAFLD, that stands for non-alcoholic fatty liver disease. So if we can assess the liver in various stages of NAFLD, both qualitative and quantitative, we've not only just improved that patient's care, but possibly their outcome.
Well, I'm really glad that you brought up NAFLD. Dr. Hidalgo will be discussing that topic shortly. Thank you so much, Jenny, for your time today and for providing me and everyone else with a lot to think about with the new RS85 Prestige.
Thank you. Thanks for having me.
Absolutely. Well, the upgraded RS85 Prestige really does offer a lot of advantages for advanced diagnostics, but don't take my word for it. We are fortunate to have noted diagnostic radiology specialist, Dr. Ronald Hidalgo. Welcome.
Thank you. Thank you very much for having me here today. I'm really happy to talk to you about the machine today.
Excellent. We're very, very happy to have you. Now, I am going to be asking Dr. Hidalgo several questions to get his diagnostic radiology perspective around non-alcoholic fatty liver disease and how he uses the RS85 Prestige to assess the liver for this condition. Then he will be answering some audience submitted questions. So that's good. You guys are going to have some of your questions answered today. Dr. Hidalgo, thank you again for joining us. All right. Question number one. For those of us who are not familiar with non-alcoholic fatty liver disease, please give us a brief overview.
Liver disease is an interesting etiology that's been evolving in the U.S. and throughout the world over time. For a while, we saw a lot of liver disease that was predominantly viral-based or alcohol-related. But as we've changed and the way we live our lives has changed, we've started to see that obesity and diabetes have become very prevalent in the U.S. And with diabetes and obesity comes other challenges beyond what you're used to hearing about. And one of those is fatty liver disease. This has become known as non-alcoholic fatty liver disease. You may have heard other terms for it: non-alcoholic fatty liver, non-alcoholic fatty steatohepatitis, but these are really all terms for the same thing. And what we're talking about in these situations is as your body kind of evolves, as you kind of increase the fat content to process things, you're also depositing fat inside the cells of your liver. Now, they might not sound like a big deal to you, but in reality, these fatty cells aren't meant to be inside your liver cells. And over time, they can cause inflammation of those liver cells. And as you keep having recurrent bouts of inflammation, recurrent attacks of inflammation, your liver will eventually begin to change. Those changes you can see with having multiple inflammatory attacks of the liver. You can see that evolving into a fibrosis, and eventually what we know of as cirrhosis, similar to what we've heard of with viral hepatitis and alcoholic hepatitis. You'll eventually end up kind of in a similar place. The trick is that we don't have a really good way to evaluate that. So what we're trying to do is, using the RS85 Prestige, find a better way to evaluate fatty liver disease, how to monitor it. And this becomes really important because fatty liver disease is not only a U.S. problem, it's become prevalent in Asia, the U.S., all over the world. We're seeing 30% of the population presenting with fatty liver disease. So this is much higher than some people expect. The trick is, you don't always know you have fatty liver disease. A lot of times it's found incidentally when you go to the doctor. You get lab work back and the doctor says, oh, your liver enzymes are elevated. Like, why? I'm not sick, why are they elevated? Well, a lot of times this might be what's happening. Your liver is starting to have these recurrent silent bouts of inflammation. And this is what we need to monitor because these are things that we can prevent. These are things that we can treat. And so if we can catch it early and we can find a way to monitor it, we may be able to help you stop the progression of this disease. However, our current technology isn't quite there. So with some of our newer machines, though, we're starting to see the ability to monitor these things, and not just visually, but actually quantify this value.
Okay. So tell us about the technologies offered on the RS85 Prestige that help you assess the liver for NAFLD.
Perfect. So in the past, we've been able to evaluate the liver for fibrosis. We were able to say, okay, the liver's becoming much harder, much stiffer than we're used to seeing. But fatty liver doesn't always start that way. Fatty liver disease just becomes, for us as radiologists, kind of a change in the perception of the way we see the liver. And this has been traditionally a very, let's call it, qualitative assessment or subjective. Each radiologist is slightly different. We all have a different threshold for what we'll call. But a lot of the changes that we see are very similar. The liver becomes a little brighter. We lose some of the structures that we're used to seeing, like a little rim around vessels. And sometimes it's hard to see the entire liver itself. So these are what I said. We call them qualitative changes. And there's no hard way to quantify that. And I may see it different than another radiologist may see it. And so what we want to do is we want to find a way using ultrasound to quantify that. Because once we can quantify it, we can truly begin to monitor somebody over time and not just somebody saying, I think it's this versus you think it's that. So that's really our goal with this new technology and what we've been working to get to.
So that's really interesting. It sounds progressive as well. Would you mind giving us more detail on the 3 properties that you mentioned?
Sure. And so one of the things that happens is, like I said, you see those changes in the liver, whether it becomes brighter or harder to see the structures or harder to see through. Well, those 3 properties are called echogenicity, attenuation, and scatter. These are really the things that we need to measure. So using the RS85 Prestige, we're actually able to measure some of these things and assign them values. One of the technologies is EasyHRI. And what this is called a Hepatorenal Index. And so essentially, you take a picture of the liver, a picture with the liver and the kidney in it. And the machine is actually able to auto-quantify and segment those anatomy out. So it can tell you this is liver, this is kidney. And once it's done that, it actually can put little regions of interest, little circles, right where they need to put it in the kidney and the liver to measure that echogenicity. So it'll tell you how bright that spot is and how bright that spot is. And using that, it'll create a ratio. And that ratio is what we use to determine whether or not we think the liver's gone fatty or not. Because you're not only comparing the liver to itself, whether it's brighter than it should be, but you're also comparing the liver to the surrounding tissues. And the kidney has been shown to be one of those tissues that's reliable. The problem is not all radiologists are going to put things in the same place. So using the technology of the machine, we're actually able to put these ROIs more automated using artificial intelligence and deep learning. So we're able to try to repeat this process over and over again, patient after patient, or within the same patient over time, depending on different sonographers or different radiologists. So you're hoping that you can get a better tracking of the patient's liver disease over time and assign it a number. The other two that I talked about were scatter and attenuation. Attenuation really refers to how well you can see through the liver. As those fatty cells deposit in the liver, it actually becomes harder to see all the way through the liver. So it makes it much harder for us to be able to evaluate the liver. But again, it's a little subjective. We know that it's getting harder to see through the liver, but does it mean it's mild, moderate, severe? That can vary between radiologists. So using the tissue attenuation imaging technology on the machine, you're able to put a small region of interest in the kidney, in the liver, and using that region of interest, assign a value to that region of interest. That's actually measuring how the fat cells are changing the way the ultrasound beam moves. And using that over time, we should be able to monitor whether your disease is progressing or whether the treatment is working for your disease. The third one is backscatter. Backscatter is one of those fancy terms we use in ultrasound for physics. And it really is a measure of when an ultrasound beam goes into a liver, it's hitting a bunch of different tissues. Everything is a little bit different. And that difference in tissue actually sends signal back to the ultrasound, and that's what you're seeing. And that can give the liver kind of a speckly look. But as you get fatty deposition in those cells, you can actually increase that backscatter. And the more backscatter you have, the brighter the liver looks. And that's one of the reasons why when you look at a person with fatty liver, it looks so much brighter than a liver that's not. And so, similar to what I was telling you before with the attenuation, we're able to put an ROI in there called tissue scatter imaging. And using that, we're able to measure that amount of increased scatter and quantify it. So between all this, now we're able to quantify how far or how well our treatments are working and give you a better idea of what to do with your liver disease.
Wow. That sounds complicated and user-dependent.
You know, to some degree, it has been in the past. Like I said, it's not only user-dependent on the image that you give me, but it's user-dependent on the radiologist and what we perceive. But like I said, this technology really is trying to use artificial intelligence to try to help you assess these areas better. So the ROIs are picked for you. But of course, with all technology, we need to be able to oversee it. So you're able to fix this. You're able to change it if you don't think it's in the right place or do other things. So, but the idea is that the machine can try to help you get the best positioning that you can possibly be in. But again, everything requires oversight. So we as radiologists and our sonographers need to be mindful and make sure that we're getting the right information to the patients.
Wow. Talk about the tools TAI and TSI.
Sure. Like I said, you know, when you do these tools, you're going to see these regions of interest be put on the patient. It's very easy to do. You're going to have the patient in the natural scanning position. You may have them hold the breath a little bit so that the liver's not moving. You want to find a nice spot right in between the ribs. Put the probe in there, get a nice little window where you can see the liver very well. Once you put that in there, it's going to automatically give you that value once you put the ROI. Real time, real fast, takes a couple of seconds.
Wow.
So this isn't really adding any time to your scan or making you stay in the hospital any longer to get your scanning done. The one exception to that is elastography. So once your fatty liver disease has progressed, you may find that your liver becomes a little harder, a little stiffer. Once that starts to happen, you can actually see the fatty content of your liver decrease. But that's because you're having the counter happen. Your liver is becoming a little harder. The fat cells can't really get in there as well. So for that, we use shear wave elastography. And with the RS85 Prestige, we're able to do 2D shear wave elastography. Using that, it's very similar technology in the way it looks to some of the other ones that we talked about. But one of the differences is it's constantly evaluating the liver multiple times per second. And so one of the things that happens is it can take a little bit longer. You want to make sure you get reliable data. So not only are we going to show you a map of the data that you're getting, but we're going to show you a map of the reliability of the data. So you may have to take the image multiple times. So when you add elastography on top of the two technologies we talked about, it can increase the scan length a little bit because you want to make sure you get the right measurements. And there are tools on the machine to help you do that. We have things called IQR and the reliability maps, and those help the sonographer be more confident in the measurements that they get. And those are the things that we and radiologists are going to show in our reports.
Wow. So after collecting this data, how is it compiled?
So the data is going to show up on the machine, on the images that we take. It's going to show not only the actual number that we're looking for instance, in EZHRI, you'll see that ratio, but it'll actually show you the values of the numbers inside those in little regions of interest. With the TAI and the TSI, it'll show you the value, the mean and the average on top of the number that you actually want to see. So that number is then relayed to the radiologist, and we'll take that information and we're going to put it in our radiology report. And that's what we're going to convey to our ordering providers and let them know this is how we're helping you monitor your patients.
Wow. Thank you so much, Dr. Hidalgo, for answering my questions. But now we're going to turn to some of our audience members' questions. Here's the first one. What is the optimal cutoff to detect steatosis?
So it depends on the technology you're talking about. One of the ones that we talk about, the EZHRI, again, these are all things that we're developing. These are all, let's call them, not works in progress, but technology that we're working to figure out how exactly to make it the best.
Okay.
So the EZHRI, in my experience, like I said, you're comparing the liver to the kidney, and it gives you those values. So I found about 1.3 is about the range when I'll start to say, okay, maybe that's a little bit of a fatty liver. And as it moves up into the 1.6, 1.9 to 2 range, you get more confident in your number. Now, each department is going to have different cutoffs. Each radiology department is slightly different. So depending on the sensitivity that your radiology department wants to have for calling fatty liver, we'll change that number to your absolute. But 2, in the range of 2, you're almost always seeing a fatty liver. If you have an EZHRI of 2 or above, it almost is. TAI and TSI give you slightly different numbers. And again, the hard values are not totally established yet on what they should be, but I find that it's most useful when you look at it on a patient-by-patient basis, monitoring each patient. And then as we move forward and get more data from more patients on these things, we'll be able to say, this particular value correlates to certain stages of fatty liver disease.
Would you say the same is true of attenuation and backscatter in the liver?
Absolutely. The values, again, aren't totally hard and fixed. They're evolving constantly. So to give you the hard number is a little difficult. It's a combination of my looking at it, seeing the number, and then starting to quantitatively and qualitatively relate the two. And so once we start to do that, we'll be able to get these hard numbers. But for now, it is more of a patient-by-patient trying to assess how a disease is progressing or improving based on their treatment.
Here's another question from one of our audience members. How much time does it take to acquire TAI and TSI?
Oh, seconds. Once you get the window in there, it's just a matter of pushing a button on the machine, pushing one more button to pick the area you want. It'll turn on the ROI, you make sure it's where you want it, and then you're done. So minute, 2 minutes maybe added to your exam. If you want to do a more complete scan and add elastography to that as well, you may be looking more in the 5-minute range. But really, it's minimal amount of time to get it done. Absolutely.
Yeah, that's really fast. Is that true for shear wave imaging also?
Yeah, and shear wave imaging, the 2D shear wave imaging, takes a little bit longer because you want to make sure that you have those high reliability maps. And you want to make sure you're in the right window. So there is a chance that you may have to do repeated measurements if you're not able to get your reliability in the right area. There are other things that go into why an image may or may not have a great reliability because you're really looking at a 3-dimensional space, but in a 2-dimensional way. Right. So things outside the image can affect your image. So you need to make sure the window you're in is good. So that's why I say that when you add the complete exam to have shear wave, you're really looking at more of a 5-minute add-on, less so than just a minute or 2 to do the fatty liver assessment.
So how would I know if I'm getting good results?
When you're doing the shear wave has that reliability map. And we have set standards using the IQR to say that if we're above a certain number, in this case 30%, that it would not be a reliable measurement and we shouldn't count on it. But if we can get your value below, if we can get that IQR below 30%, and the reliability map looks good, then we can say that this is an accurate measure of your liver as far as fibrosis goes. The other two, at this point, you're relying more on the sonographer to put a good window in. It doesn't have the same reliability maps or anything like that to tell. So it's just making sure when you, as a radiologist, evaluate your image, that you agree with how the sonographers put the ROI on, making sure they didn't have vessels or any biliary ducts in there, because those can change the values a little bit because they're a different type of tissue.
Wow. How do all these data sets get reported?
So all of these go into the radiology report. They're on the machine, so it's always accessible on the machine. And then it comes into our PACS systems. And using the PACS, we could see all that data that you got as the sonographer. And then I take that and I put it into the report in a way that lets not only the insurance company know what we did, but it also lets each physician over time know the technique that we used, where we did it, and how reliable our measurements are, so that when you come in later, you can try to get as close to that same area as you can, so that we know over time we're measuring the same type of fibrosis or fatty liver area.
Wow. Thank you again, Dr. Hidalgo,
Absolutely.
for sharing your insight around liver assessment and your use of the RS85 Prestige. I know I found our discussion extremely informative, and I hope everyone that's participating in today's webinar did as well. Thank you again for joining us.
Thank you for having me.
Thank you. Well, thank you for joining us today, everyone, and thank you to our presenters. We appreciate everyone making time to learn more about the RS85 Prestige and how its advanced diagnostic features are being used in medical settings for more confident diagnosis. Please look for an email from us, which will include a link to the RS85 Prestige website, as well as information on some exciting promotions that we will be offering for a limited time to you as a webinar attendee. We'll also provide information on how you can schedule a demo, whether in person or remote. In the meantime, if you want to learn more, please visit samsunghealthcare.com and search for RS85 Prestige. Or if we didn't answer all of your questions today, email us at marketingevents@neurologica.com. Thank you again. We are so excited for you to experience for yourself this revolutionary change in diagnostics. Thank you again, everyone, for joining us. Here are some of the highlights of the RS85 Prestige. Advanced diagnostic imaging with powerful processing speed and innovative features. Advanced intelligence, or AI, for reliable assessment. Liver quantification tools. Advanced productivity and streamlined workflow. Voted AntMini.com's best new radiology device semifinalist. Again, thank you everyone for joining us.